We are here today to update the media and the nation on the crisis hitting the community of Bearskin Lake. As you are aware, the COVID crisis has overwhelmed this community in northern Treaty 9, and it has forced a halt to the day-to-day operations that are necessary to keep the community safe. We have now over half the community in quarantine. This is a community that has reached out to the federal government, asked for a week now to have the military come in with logistical support in order to keep people safe. This is a pretty straightforward request. This shouldn't be that hard to accomplish. We have four key ministers who could have played a role in helping to alleviate this situation: Minister Blair, Minister Hadju, Minister Anand, Minister Mendocino, and yet the community at this point is still waiting for help. This issue is magnified in the treaties, communities of Treaty 9 and in many of the Northern First Nations because we know the pandemic has completely stressed out the health systems across the country, but it is magnified a thousandfold in communities where they do not have the resources, they do not have the teams, they do not have the medical supports. And as we speak with the situation in Bearskin Lake, we know that we have had outbreaks in other communities like Attawapiskat, Arrowland, Ginugaming, and North Caribou Lake. So the question we're asking is, when is the federal government going to step up with their fiduciary and their legal and moral responsibility to respond to the reasonable call of the people of Bearskin Lake for help? When are they going to look at this need to support other First Nation communities who may be facing similar situations? This is an issue that the Prime Minister needs to address, and he needs to address it quickly. Nous sommes aujourd'hui pour expliquer la situation à Bearskin Lake. La communauté a été bouleversée par la crise de COVID. Et c'est clair, la communauté n'a pas les ressources nécessaires pour assurer la sécurité de la communauté, car la majorité de la population est en quarantaine. Bearskin Lake a demandé le soutien de l'armée canadienne pour fournir une aide logistique afin d'assurer la sécurité des personnes. Pourquoi M. Trudeau et le gouvernement fédéral a-t-il ignoré la demande d'aider les habitants de Bearskin Lake? Ce n'est pas une question complexe. Nous demandons au Premier ministre, M. Trudeau, d'expliquer l'indifférence systémique aux besoins des communautés des Premières Nations qui luttent contre le virus Omicron. Où est le plan de soutenir la communauté de Bearskin Lake et les autres communautés qui étaient affectées par la pandémie maintenant partout dans le Nord Ontario et partout le Canada? Thank you. I will now turn this over to Chief Cam to explain the situation that they're facing on the ground right now in Bearskin Lake. Thank you, Chief. You'll have to unmute yourself.
Okay, thank you. Sorry about that. Good morning. All right, at this moment, it's been, I guess, 7 or 8 days since we declared an emergency here in our community. And at this point now, I think we're almost at the breaking point. I think people are exhausted, I guess, emotionally and physically. Like we have about, I don't know, close to 30 frontline workers here doing everything from grocery shopping, hauling water, wood, and everything that needs to be done in the community. So I think even those people that are in isolation, I think they're emotionally, I think mental health capacity is impacted at the very level. You know, they can't. They have a lot of questions and they want to see help coming, like something positive to be mobilized from the government which we had asked for over a week ago. And I think as of now, I would like to see something happening for my community, because I don't know if we can last any longer than we can. Like, for example, last night, we had a power outage for 2 hours, excuse me. And and that kind of threw everybody in a panic mode because of it gets very cold at night at -30. So I think if we can have some response from the government, that would be appreciated at this time now. We need the help now and boots on the ground. Thank you.
Thank you, Chief. I'll turn it over now to Frank McKay from the Wendigo Tribal Council.
Good afternoon. My name is Frank McKay. I'm the chairman and also the CEO of Wendigo First Nation Council. We serve 7 First Nations in the northern remote part of northern Ontario, the remote area, and Bearskin Lake is one of our members, one of the 7-member First Nations that we serve. I would like to start by stating a fact. By the time federal resources were identified to support the health crisis in Bearskin Lake First Nation, 50% of the community members had become infected. As of yesterday, 201 cases were reported, and that is a high number to comprehend in relation to the community members, which is remote and does not have the past capacity and infrastructure necessary to respond to such a crisis. Bearskin Lake declared a state of emergency on December the 28th. The community went into immediate lockdown, but due to overcrowding and lack of community infrastructure, where the infected could not be separated from the infected, the virus spread very quickly. Federal resources were slow to come in and were confirmed only after numerous meetings and extensive lobbying on our part. On January the 2nd, crisis funds were finally announced, yet these continue to be wholly inadequate. The community continues to struggle due to the lack of financial supports and personnel on the ground. The Bearskin Lake has never experienced of this kind of emergency of such huge proportions. This is an unprecedented experience for the community of Bearskin Lake person. They're still in need of basics like firewood, food and water, and on-the-ground personnel to replace the community workers who have never become sick. And they're also in need of mental health support services. Because of the time of this, there's a lot of fear, anxiety, stress that comes with this disease. Sufficient money for flights and out of the community is crucial. This is the only way to travel into the community. Yesterday, it was confirmed by our doctor because of the overcrowding and lack of community space and no isolation units, infections will continue to rise. As of today, the number of infections have not flattened, and the community will continue to remain in crisis with no clear end in sight. They do not have the financial and human resources necessary to deal with such a crisis and are completely overwhelmed. Yet Prime Minister Trudeau's government continues to drag their feet and provide limited resources to address Bearskin's crisis. As Canadian citizens, we deserve the same rights and recognition as all other Canadians. When we ask for help, we should get an immediate positive response. Bearskin Lake First Nations was quickly decimated by the virus, but immediate federal support did not come. This continues to happen. When will our Prime Minister Justin Trudeau give us assurance that reconciliation is his government's top priority? He has repeatedly stated that in national media and to the public that he will start a reconciliation process with the First Nation by improving relationships and respond to the urgent needs of the First Nations. So we are asking why is it taking his officers so long to acknowledge the crisis and provide the little extra support, which I need to say again is not adequate to properly address this human crisis. Prime Minister has also said that he will devote resources to improving community infrastructure, overcrowding houses, and poor health services in our communities. When will we see this promise become a reality in our remote First Nations? In this country where the standard of living is among the best in the world, why is it that our people continue to live in such dire poverty? We have been put in yet again a place where we, as remote First Nations, are beggars in our own land. Overcrowding, poor standards of healthcare, lack of clean water, and access to affordable food are the standard, not the exceptions. We experience chronic neglect for all levels of government. Prime Minister Trudeau, Mr. Haido, I'm calling on you again today to take action. Listen to us and provide Chief Kaminawada and his members with the support that they so urgently need. And I will offer this warning many First Nations communities living in the same conditions as Bearskin Lake. I fear that this situation is not the last one we will have to face in the days ahead. Thank you.
Thank you so much, Frank. I'll turn it over now to Grand Chief Derek Fox.
Bonjour. Good afternoon. I'd like to acknowledge Bearskin Lake First Nation and all of our communities who are struggling to deal with the steady rises of COVID-19. As a member of Bearskin Lake and as Grand Chief of Anishinaabe Nation, I am here to support my chief, Lefty Kaminawada, and acknowledge the tremendous work that he and a handful of community members have been doing to keep their community safe. The situation in Bearskin Lake is unprecedented. Nearly half of the population have tested positive for COVID-19. This will only get worse and spread if the virus is not stopped. Most of the houses in Bearskin Lake First Nation are heated by a wood stove. The community needs people to chop wood and deliver to every house. Water, food, and medical supplies also need to be delivered. People and vehicles are required. People are also required to keep the vehicles running in -30 to -40 weather. This is why Chief Cam is calling for boots on the ground. Bearskin has received tremendous support from neighboring communities like Muskrat Dam and Big Trout Lake, and we are so grateful for their assistance. Our office has received several offers of assistance from doctors, Indigenous groups, everyday citizens who just want to help. And once again, miigwech and thank you to all of them. NAN and our tribal councils are responding as best as we can to arrange charters to ship vital supplies of PPE, food, and water. But we are not equipped to respond to such emergencies. There's a great picture on social media of a line of 20 people on snowmobiles making a 2 to 3 hour drive to reach Bearskin from Big Charlie Lake and to chop wood and to help people heat their homes. This is the traditional way of our people. When there's a crisis in one of our communities, we band together and we help each other. We acknowledge that the federal government has made funding commitments to Bearskin Lake. Crisis response in remote First Nations, however, is not measured in just dollars and cents. It's not just about submitting proposals and receiving funding. Once again, it's about having people on the ground to help. We look to both Canada and Ontario to provide the necessary support to all of our communities experiencing similar challenges. As of yesterday afternoon, there are 357 active cases across NAN's 49 First Nations. 3 of our communities have had to declare states of emergency: Bearskin Lake First Nation, Arrowland, and Ganugaming, as the COVID cases continue to climb. All of our communities rely on support from our treaty partners, and it is their obligation to provide that support. We need to cut the red tape and work together if we are going to get through this. Thank you for listening, and miigwech.
Thank you, Grand Chief. I now will turn it over to Charles Fox, who will sort of lay out the situation of where we need to go forward.
Thank you, Charlie. Miigwech. Nina kumag mandong manan Nogumga yishiga gamini mata zone ko gamamchmache wijawena mugak uega nakshkamakana zone. In terms of the situation on the ground there, Charlie, has been outlined by the speakers. And when you look at the fact that we're overwhelmed, we need assistance in all categories: medical, transportation, personnel, food, water, vehicles. The list goes on and on. And when you have the government responding that they're thinking about sending in the military, I haven't seen anything yet. They're equating that to having the military deal with the wood cutting issues and distributing wood to the membership. And they're also looking at distribution. When you look at the needs that have been identified in terms of the gaps that exist, you have to look at security. You need a good 15 to 20 security personnel in the community. You need medical people. You need more nurses. You need more testing materials and kits, and you need antigen rapid tests. You need PPE equipment. We don't have that. We need transportation. We need about 20, 25 vehicles to distribute all the supplies, to haul the wood, cut the wood, and to as well transport potential patients. We need accommodations for personnel going in. I've heard that 40 personnel were dispatched. I haven't seen anybody going to Bearskin Lake that were dispatched by the government. We have, to the best of our ability, sent our own personnel, and we have to follow strict protocols that are set up by the First Nation before our members can go in. I've heard about the government subsidizing the efforts. They've given us $1.1 million. Charlie, it costs $25,000 to send in a charter with 16 personnel. 16 personnel, $25,000. The estimate that we had was that we would need about $1 million worth of charters alone to address getting personnel in there. We're not talking about groceries. We're not talking about water that needs to be sent in. We're not talking about all the supplies and materials related to medical. I mean, you got to look at the whole picture in order to begin to contain the Omicron virus that we suspect is there. From all indications, it is the Omicron virus. So when you look at all the potential gaps that exist there, you have to look at the total picture. And so this particular case, Bearskin Lake, is a national case example of how we should respond to a community in crisis. 50% of the population, 201 positive cases. And, the personnel, the staff, administrative, that were responsible for maintaining and sustaining the community have been laid aside. They are decapitated. They can't function. And how is government going to respond to that? Both levels of government. How are they going to respond to this crisis? We're going to be a national case example in terms of how we're handled, and we're going to learn a lot from what's happening in Bearskin Lake. And I hope that both levels of government, non-governmental organizations, and all other organizations will rise to the occasion and meet the challenge head on. Thank you.
Thank you so much for that very clear analysis of what we need in order to get through this. I guess we'll turn it over to questions from the media at this point.
We're now ready to take your questions. Just as a reminder, please use the raise hand function or send me a message in the chat if you'd like to ask a question. You will get one question and one follow-up. Nous sommes maintenant prêts à répondre aux questions. Pour rappel, pour poser une question, veuillez utiliser la fonction lever la main ou m'envoyer un message. First question goes to David Aiken at Global News. Go ahead, David.
Thank you very much. I hope everybody can hear me, that I'm unmuted now. Thank you, Charlie, and thank you, Chiefs, for taking time today. And I'd really like to direct my questions to Chief Cam. And Chief Cam, I understand, I'm curious, how are you personally? How are you and your family? I understand that you're among those who are having to isolate. So I wonder if you can tell us about the experience that you personally and your family are going through at this time. What's it like?
At this point now, I guess I'm very exhausted. Like at the first day of our positive case, I came home at 3 o'clock in the morning. So I was on the front lines for the first few days, but I had to isolate due to my son being positive. So I've been in isolation since Monday. So I'm exhausted at this moment. Thank you.
Thank you, Chief. I appreciate that. I had the chance to chat with Salma Makwa this morning, and I know many of you know that he was up in the community yesterday. And, one of the things Saul said to me was the request for help came on January the 3rd, I think, from Chief Cam for help. But the federal and provincial governments have a process and they have paperwork. And in Saul's mind, Saul used the word, that's colonialism 101, that the senior levels of government have to insist on this process when the need for help is pretty apparent and pretty clear. So Chief Cam, I don't know if you want to comment that, or Chief Fox, I'm curious about Saul's observation about the way the federal government sort of tries to apply this template when there's what's clearly an absolute crisis going on in the community.
I'll let Charles Fox answer that question. Thank you.
Thank you very much there, Chief. When you're looking at the particular situation on the ground that exists in Bearskin Lake, we met with Minister Hadju. No, I talked to Minister Hadju. We didn't meet with her. And I impressed upon her the fact that Bearskin Lake has an outbreak. And that was on the 28th, I believe, as soon as the first cases were detected by the testing that was conducted by the community. And I talked to her on the 29th, and I said, this is the beginning, and I believe you should talk to the chief as well as the grand chief, because there's other communities as well around Bearskin Lake that are starting to see an Omicron breakout. And so she agreed to set up a call with the grand chief and the chief. And then she had me call her chief of staff. The chief of staff said, oh, no, the minister's got national issues. We'll have to bump this conference call later on the day. And I returned the call to Minister Hadju, and I said, this is the response from your chief of staff. And she said, well, he's right. I don't want a big conference call. I'll just give me the chief's cell phone number and I'll call him directly. So that kind of dismissive attitude, that kind of attitude in terms of, your issue is not important. That's what we're running into here. And when Saul talks about colonial attitudes, and I'm going to bite my tongue here. When you talk about that type of attitude towards a community in crisis, that's totally unacceptable. I mean, if you prorate the 50% of infections, if Metro Toronto, the Toronto GTA, you'd be looking at well over 1 million infections. And I can positively tell you that there would be an international outcry to do something. But because we're remote and we're remote and we're First Nation, people don't give a damn. Thank you.
Thank you, David. The next question goes to Olivia Stefanovic at CBC News. Go ahead, Olivia.
Thank you so much for taking time to speak with us. I'd just like to follow up on that point about this request for military assistance. Can you take us through a little bit more about what happened since you made this public request 5 days ago for military assistance? Did anybody from the federal government speak to you directly about this or suggest that this would be something that they could offer?
The first, if I can respond to that, Chief, I've been involved with the acronym is PEOC, P-E-O-C. It stands for the Provincial Emergency Operations Center. And we usually get a couple hundred people on the call. And I made the point that we needed some movement on the ground to deal with the epidemic and the crisis. And that, if there's over 200 plus personnel on this call, then somebody out there should be able to respond and help us. And I know that the military is on the line because they did speak up, and they said that we had to follow due procedure. We had to follow and fill out forms, and we had to make the request. And so, we've responded to that. And the military has been called because in order to contain the Omicron, the variant, the virus, you have to take control of the whole element of the operations on the ground. You don't, as I said, the head is the decapitation of the administration, the political leadership. It's almost non-existent. So we need that help on the ground to be able to deal with all the different gaps that I identified, that I talked about. And that's why the chief made that declaration and why the chief asked for the military to be sent in to provide that hands-on assistance.
Just as a sorry, just wanted to clarify on that, Chief and Charles. My understanding was that you were told that you had to exhaust all other options before the military came in. So I'm wondering how many options you have left before they show up.
Well, I think we have exhausted all options. We asked for funding. They gave us $1.1 million, and $1.1 million will cover the cost of charters. It's not going to cover all the cost on the grounds that we need in terms of isolation, in terms of accommodations, in terms of food and supplies. It doesn't go anywhere to addressing the overall need that we have. And yes, we have to exhaust all avenues in terms of trying to address the situation on the ground. And I believe that we have done that. So we're asking the military to step in, but we also want the military to understand this is the holistic approach that we need, not just to come in there and cut wood, and not just to come in there to distribute supplies and food. We're talking about helping the community in totality, medically, as well as security, transportation, vehicles, etc. It's got to be the total picture.
Thank you. You mentioned isolation. I'm wondering if the community has requested isolation units from the federal government, and if you've been given any indication that they will be providing them, and how many.
Chief, I can respond to that.
Yes,
just for your information there, media, I'm the community liaison for the First Nation, and I'm handling all these on-the-ground issues. We did put out a request for isolation. The First Nation, for one thing, does not have any capacity for isolation. The response from the federal government was that they would give us 3 domes. And that's the last we heard. In terms of how we get the domes up there, how we put them up, all the ground clearing that's going to be required, nothing else has transpired. We don't know where the 3 domes are. We don't know how they're going to be transported, and we don't know in terms of ground personnel and putting up the domes. So the request has been made, and we're just waiting for the next steps. I'm hoping that the domes will be there yesterday, but they're not there. And certainly, I think we want to look at any other options in relation to isolation that may exist, such as removing the people who are infected to a safe environment. If we can do that off reserve into urban sites. But then again, that requires a lot of logistical and challenges in terms of working with the other NGO partners that we would have to engage.
Thanks, Olivia. The next question is going to Creason Ajte from CTV News.
Hi there, Chiefs. Thank you for taking my question. I was wondering, as I'm hearing all of this, and this is the call out for the federal government and the military, but I'm wondering, what is the current vaccination rate there? How many people in the community have been vaccinated, and when were the vaccinations put out there?
Hi. Okay. From my community, this is Chief Cam here. From what I hear, we have about 80% vaccination rate in our community, which is a population of 400 plus. We did our booster shots back in November, and we were just about, and I think the 5 to 11-year-olds got their first vaccination shots in the second week of December, and we were just about to start that, and then this happened. But and for example, for myself, I had my 2 doses and a booster. Thanks.
Do you have a follow-up question, Greason?
Sorry, I had myself on mute here. Chief Fox, what is your personal message to the Prime Minister? I know the other speaker here had a very poignant message for the Prime Minister, but what is your message for the Prime Minister on this and the community needing help?
Chief Fox or Charles Fox?
Pardon me, Charles Fox.
Okay, Charles.
Well, I have 2 messages. One is truth and reconciliation. Where is it? The truth is we're in crisis, and there's no federal response. Why is there no federal response? Can you please look into your hearts in terms of why you're not responding to our crisis? In order to have
Am I unmuted? Can you hear me?
Yes, we can hear you now.
My question's for anyone who wants to answer, I guess, Charles, Derek, Charles Fox, I mean, Derek or Frank, or Chief Cam. But just, I guess, to clarify, you're looking to have military support on the ground as soon as possible. Do you have an expected timeline? I did speak with somebody from emergency preparedness department, and they weren't able to give me a timeline, although they did acknowledge receiving the request from the province last night. So if you can just kind of confirm that you're wanting kind of soldiers on the ground now, is that correct?
Basically, that's correct, Arwilla. We need soldiers on the ground to be deployed. And we're talking about personnel that would be cutting wood, would be distributing supplies, would be freight handlers, would be drivers, mechanics would be nice. If they could take in their own vehicles, that would be great, because vehicles are depleted. And so you're looking at personnel, my best guesstimate would be about 60 to do all that. And we don't have any indication at all in terms of timelines.
And then I guess, Charles, this is for you as well. With Grand Chief Fox saying, I think he said 357 cases across NAN now. Most of those looking like it's in Bearskin Lake. What's the difference? And because you're speaking about the broader systemic challenges faced by First Nations during crises like this. What's the difference between First Nations like Bearskin Lake and Sandy Lake, for example, where currently there's about a dozen cases that they've been able to contain fairly well to households? I'm thinking because of certain restrictions that were perhaps afforded early on, but at this point they're not seeing the spread that Bearskin Lake has. So what's the difference?
The difference in relation to that is the measures that are in place have to be followed to the letter. I know that we have testing by some of the airlines, but not all the airlines. So you have people that will come in without being tested properly. The First Nation has a strict protocol in relation to COVID testing, that you have to have that molecular testing and you should have a negative result before you can come into the community. And I know that, as I said, and I'm being repetitive here, some of the airlines are following that to the letter. But there are airlines who are not following that, and people will come into the community without that proper testing. Plus, the community has their protocol that people coming in need to stay home and be isolated for 7 days. Human nature dictates, Willow, that not everybody follows those instructions. And in this particular case, that's what happened. And when you have the Christmas spirit and people are involved in the Christmas spirit with the feastings and get-togethers, family get-togethers, then that's ripe for the variant to spread itself.
Miigwech.
Thank you, Willow. The next question is for Adam Riley at Thunder Bay Television News. Go ahead.
Yes, thank you. I'm just curious as to the situation, whether or not anyone has been, any of the cases have been so severe that any members have had to be medevaced out so far. We're also getting reports through the case counts and numbers through the Northwestern Health Unit today that there have been 3 deaths that have been associated with in the region. I'm just not sure if there have been any deaths associated with this outbreak so far as well.
Okay, hi, this is Chief Cam here. I just want to answer your question in the best as I can. Like during the outbreak of a global pandemic, in this community alone of this Bearskin Lake, 400 plus community members, last year we lost 3 community band members to COVID, and that is very saddening. But and to answer your question there, with this recent outbreak, we are been fortunate. I guess I don't know if I can say that nobody hasn't been medevaced yet, but I think since our elders have been tested positive now and this week, I don't know what to expect now. Thank you.
Do you have a follow-up question, Adam?
No, I'm good. Thank you.
Okay, thanks, Adam. The next question goes to Xiao Li at City News. Go ahead.
Hi, can everyone hear me all right?
Yeah, we can hear you.
Excellent. Thank you for taking the question. And apologies for my ignorance on this one. The Indigenous Services Canada website lists 2 long-term boil water advisories at Bearskin Lake. And again, my ignorance here is showing what is the drinking water situation on the ground right now in Bearskin Lake?
Okay, all right. I think, okay, with the water situation, that's one of the things that the ground crew, frontline workers are doing right now, is hauling water from the store, what is done through reverse osmosis, I guess you can call it, the drinking water. We don't drink the tap water, so. I don't know if that answers your question or not.
I think that helps a great deal. Thank you very much for that clarification. And just as a quick follow-up, could you just give me a rough estimate or a guess as to how many healthy people are left on the ground in the community that can help out, whether that's people from Bearskin Lake or people who have come from outside the community to pitch in?
The local people have less than 30, but there's I don't know how many I have from the outside, maybe 10 to 15.
All right, thank you. Thanks very much.
Thank you. We have a couple more people here to ask questions. So the next question will go to Tim Brody at Sioux Lookout Bulletin newspaper. Go ahead, Tim. Tim, are you there? I think it looks like you're unmuted. Okay, we will come back to Tim. So we're going to go to David Aiken at Global News for another question. Go ahead, David. Okay, and David seems to have disappeared as well. So I'll do one last call for questions. We'll see if maybe Tim can join. Final call for questions. Please use the raise hand feature or send me a message in the chat.
There we go. This is David Aiken. I'm unmuted. Unmuted, unchained, unfreed. I love Zoom calls. I did have a question for Grand Chief Fox. Grand Chief, if you can just look around NAN territory, I just wondered, well, obviously we're focused a great deal on Bearskin, but we do note, I think you did, those two other states of emergency. And I wondered, looking to other communities, if what we're seeing in Bearskin may just be the first. I hope not. But I'm just wondering if you could give us a sort of a state of the nation, the state of the Anishinaabe Nation. There you go. How communities are preparing, are ready, are they taking steps to additional steps to lock down? Can you speak to a bit of that?
Yes, thank you for your question. And the other two states of emergencies, we've been working closely with both First Nations and of course from NAN's perspective and from Anishinaabe Nation, being a nation that we're extremely concerned about, given that 32 of our First Nations are very similar to Bearskin Lake First Nation in that they are fly-in only. And out of the 49 First Nations are all very similar, and our leadership are extremely concerned with any kind of outbreak within our First Nations. Given that once again we don't have those hospitals and doctors on call and emergency units, and should anyone get extremely sick from catching COVID, there's no quick response. So when you're living in Thunder Bay and Toronto and Ottawa and even Sioux Lookout, you have a hospital to go to. Our First Nations don't have that. So the fact that it's spreading within our non-First Nations is deeply concerning. And in saying that both levels of government do really need to take this seriously, and they do need to take action and support our First Nations any way that they can. And we look forward to hearing from them. Miigwech.
Can I add on to the comments by Grand Chief Fox? Mr. Jeb? I'd like to say that, our First Nations are not equipped to deal with the issues of infections and also how to protect the non-infected in the communities. There's no infrastructure or capacity to separate those two items, the infections and the non-infections. And it's just the infections in a household where there's a lot of families. They can't isolate by themselves. They as a result of that, the whole household gets infected, and it carries on like that. So the First Nations have to begin to look at how do we protect our people from this virus. how do we react when we get the first COVID infection? What are the plans that need to be activated? What are the plans that need to be done to ensure that the COVID is contained within the community? And when you don't have the capacity or resources to address those things, and this is a result of what happened in Bearskin Lake First Nations. When the first one was detected, total lockdown came in, but the infections have already had begun prior to that detection, and it spread like wildfire, and the community is now left with no way to really minimize and contain the infection, because as of today, we still on the rise of infections, and we see this happening with no end in sight yet. So we need to begin, the First Nations have to begin to plan out, what measures they need to take in relation to isolation. So that's a further discussion that needs to be happening with the federal and provincial governments. Thank you.
Thank you. I'm going to go back over to Tim Brody. Tim, are you able to, is your mic working now?
Can you hear me now?
Yes, we can hear you. Go ahead.
Okay, I'm not sure who this question is to, but again, we've been hearing about the assistance from the nearby First Nations for the community. We've been hearing about the needs for the community. I'm wondering, just is there anything that the every person here in Canada, Northwestern Ontario, can do to support Bearskin Lake at this point? I don't know if there's someone coordinating that or if there's a mechanism in place. I know that boots on the ground are what's needed, but is there a mechanism for people to help in this situation?
No, go ahead, Chief.
Okay, sorry about that. I'll just, there's from the offset, we're kind of operating from the back office as a command center. And then that's where people are advised to call in if they want help, what kind of service they want, if they want delivery with groceries or water. But like for band council, there was only two band councillors out of 6 of the band council are working at the moment, and we're kind of they're stressed to the limit. We're trying to do what we can to help the community in terms of getting organized and helping out getting these services running in the community. Okay, you can, Charles, you can.
Yeah, thank you, Chief. There's other organizations that are in relation to that question that are helping to facilitate the mobilization of donations and food and supplies. Of course, I, as a community liaison, is part of that, but you have Mr. Frank McKay and his staff with the Wendigo First Nations Council, and you have Mr. James Morris, who's the Executive Director for the Silicon First Nations Health Authority, to assist as well. I know that the Silicon First Nations Health Authority is more involved with the medical related issues and in terms of personnel and medical supplies, but they do help facilitate some of the donations that are being generated by individuals and organizations and other sectors of society. So you have those if you want to reach out to them. Thank you.
Yeah, I would just like to say on that, because we saw this in the Saskatchewan COVID crisis, how incredible it was. The Northern Indigenous communities and people across the country stepped up in an extraordinary manner because they care about each other. I think what's frustrating, because my phone is getting rung off the hook with people who want to help. Ordinary Canadians, how do I help? What do I need to do? So that's really, really amazing, and I think it gives me hope. But again, we go back to the frustration that this should not be that hard for the federal government. I mean, 24 hours ago, Minister Hadju said that she was working on getting 40 personnel on the ground. Where are they? She said yesterday afternoon, quote, "We are working with the community right now to determine what kind of skills they're looking for." I'm not aware of any calls where she's called to ask what kind of skills they need on the ground. That's why we're holding this press conference. So if the average person in Canada is stepping up and making calls, where is the federal government? That's their job. They need to show up.
Do you have a follow-up, Tim? Okay, the next question is going to Logan Turner from CBC News. I'm going to read it out loud. His first question is, what does it say to people in Bearskin Lake First Nation when the federal and provincial governments respond so slowly to clear public demands for military assistance?
They feel neglected. They feel they're not heard. Thanks.
Okay, and his follow-up question is, how are community members in isolation coping with the quarantine, and what mental health supports are available right now?
As far as mental health supports that are available, I would say none. But if there's any virtual mental health support or counselor, I think that would be made available to them. I think, like I said before, those that are in isolation, I think they're starting to, they're negatively impacted. What's happening even in their households. Like for example, if they see their child, like we have infants here, a 9-month-old baby being tested positive, and that's very stressful for a mother and a grandmother. Or if there's elderly, we have elders here that are positive, and we have those people that are really concerned with their grandmother or mother. So it's the emotional and the mental health level is really impacted. Thank you.
Okay, we have time for one final question. It's coming from Brenda Sockton at Wawa News. She asks, can anyone else be asked for assistance? For example, the Red Cross.
I'll answer that first. I just had this morning, just before this press conference, I had a teleconference, a Zoom session with the Red Cross, and I had a good dialogue with them, and they offered what could be most beneficial to our community. And I told them what they can offer. I will forward information to the pandemic team and coordinators then we can work it from there.
Right, thank you so much, everyone. That concludes today's press conference. Ceci met fin à la conférence de presse. Je vous remercie.